everyone, my name is Thejal Anand, and today I will be presenting over cerebral malaria, a parasitic attack on the brain. A little bit about me first. I'm a rising senior from Dallas, Texas, Hookem, and a big part of my life is HOSA. I'm VP at my school's HOSA and also was just able to participate in the International Leadership Conference where I won 4th place for my medical innovation. I'm also a part of North Texas Joet Archery. I've been competing in archery since I was about 12 years old. And yes, I was inspired by Katniss Everdeen. I'm also a published researcher because I worked in a lab at UT Southwestern for the past 2 summers, and we were able to publish an article over heart valve heterogeneity. I'm so grateful for my experience there and my amazing mentors. Currently, I'm in an internship at Johns Hopkins University Global Health Now, also under the mentorship of Mr. Brian Simpson, who's editor-in-chief there, and together we are working on writing an article over cerebral malaria. In the future, my goal is to become a trauma surgeon who is able to travel the world and address the social determinants of health all around the globe. Going back to cerebral malaria, I want us all to take a moment to just imagine in the tropics of sub-Saharan Africa, where hundreds of thousands of children suffering from malaria go to bed every night, unknowing if they will wake up the next morning. This incurable coma occurs when malarial parasites create blood vessel blockage, increasing intracranial pressure, otherwise known as cerebral malaria. Children under the age of 5 are most vulnerable to this disease, and if left untreated, the mortality rate can range from 20 to 30%. To learn more about cerebral malaria, I contacted Dr. Monique Stins, who works at the Johns Hopkins University Malarial Research Institute. She taught me that in cases of cerebral malaria, the disruption of the blood-brain barrier can lead to increased permeability of the brain. This is when the malarial parasite anchors infected red blood cells to the lining of blood vessel tissues and vessels, allowing the entry of inflammatory molecules and more malarial parasites. This causes the breakdown of that blood-brain barrier, which creates changes in the brain's microenvironment, which can then lead to the development of more neurological symptoms such as comas, seizures, and cognitive impairments. And this is what clinically presents itself as cerebral malaria. So currently in the status quo, cerebral malaria only has a clinical diagnosis, meaning that there is no scientific method of accurately diagnosing the disease. When a child presents themselves in a comatose state with a fever and malarial parasites found in the blood, they are automatically treated for cerebral malaria. But the issue with this, which what I learned when I talked to Dr. Terry Taylor from Michigan State University, she was able to clear up my misunderstandings with her autopsy study that she conducted in Malawi, which found that 23% of children dying with cerebral malaria did not actually have the disease. So let's take a look at why there is such a high rate of misclassification for cerebral malaria. Many tropical regions are endemic to malaria, meaning that the parasite can coexist and live quite equitably inside of their host body. This means that children that are infected with a malarial parasite can present themselves asymptomatically. So when those children fall into a coma, they are immediately treated as if they have cerebral malaria, even if the reason for that coma is something entirely different, such as a brain tumor, meningitis, hypoglycemia, or another different type of viral brain infection. But another really important biomarker of cerebral malaria is something called malarial retinopathy. And malarial retinopathy can be seen in this image. We can see these retinal whitenings, which are just white patchy lesions in the optic disc, and also retinal hemorrhages, which are these big purple spots. So malarial retinopathy is one of the most accurate ways to diagnose cerebral malaria, but the reason that it is not used as a part of the standard of care or to diagnose a patient is because of a lack of qualified ophthalmologists. In fact, in many regions in Africa, there is less than 1 ophthalmologist for every 1,000,000 residents. So you can see that there is a huge disproportion, which also opens the door for needing accessible technology. Luckily, a novel device has been created to help mitigate those global crises. I interviewed and worked with Dr. Vainik Joshi and his team, who created a software called Aspire. Aspire is powered by artificial intelligence to detect malarial retinopathy through a low-cost, portable, and user-friendly system. This innovation combines technology and medicine in order to revolutionize the way that cerebral malaria is diagnosed. They collected over 100,000 photos of malarial retinopathy in order to create a machine learning system with a 90% sensitivity and 85% specificity. So essentially, using this retinal camera here, anyone can take a photo of their eye, which shows the inside of the retina, and the artificial intelligence system then diagnoses them to see if they have malaria retinopathy, which can then lead to a diagnosis of cerebral malaria. So to learn more about this, I really wanted to talk to someone who had worked in clinics and worked with this device to see how user-friendly and accessible it would be. So first, I talked to Dr. Adebowale, who talked to me about how in northern areas of Nigeria, they face a lack of healthcare professionals due to brain drain, which is the drift of healthcare workers away from rural areas to seek better economic lives for themselves. So instead of a lot of qualified healthcare professionals, they have what are called community health extension workers. And these people are trained to develop and deliver basic health services in rural developing areas, which is why this invention is so amazing, because in the midst of all that inadequate experience, AI is coming in to save the day with an invaluable device. And he really just expressed how easy it was to use this device and how helpful it would be for areas that don't have people that can perform advanced medical techniques or really look into the eye and see malarial retinopathy, because just being honest, there's not a lot of people that are trained to do that in those regions, which is why, again, that device is so accessible and user-friendly. So just some takeaways of this presentation, I really want to just emphasize again how important accessible innovation is. And these innovations need to address the social determinants of health, because that's what, if people in those areas are suffering from a lack of qualified health professionals, we need strong and resilient healthcare systems that can address those determinants of health and also create collaboration between the researchers and the people working in those hospitals that can create innovation that can be used by anyone and actually helps the patients that need it the most. So I want to first acknowledge my mentor, Mr. Brian Simpson, who is the editor-in-chief of Global Health Now at Johns Hopkins. He really inspired me and encouraged me to interview all these people to just develop a holistic understanding of what cerebral malaria is and its clinical manifestations. And I was also able to talk to Dr. Monique Stins at the Johns Hopkins Malarial Research Institute, and then Dr. Terry Taylor, a professor at Michigan State University, Mr. Vainik Joshi, who's the principal investigator for Aspire, and Dr. Adebowale, who is in Nigeria and talked to me about clinical methods to use the Aspire technology. Thank you guys so much for listening to my presentation. I really hope you learned something. And here are all the different ways to contact me, my email and my LinkedIn, if you guys ever want to hear more about my work and everything I've learned about cerebral malaria, or just to stay in touch. Thank you.